Respiratory diseases in the pediatric renal disease, Palmonorenal Syndrome. By far the commonest renal disease and pediatric renal disease is nephrotic syndrome. So it has very high association with the asthma. 30 to 60% of the nephrotic syndrome do have asthma association. Almost similar amount has allergic rhinitis association along with the atopic dermatitis and your allergic conjunctivitis. So the cases are being triggered by the asthma, and control of asthma gives rise to the less amount of the disease and lesser amount of the relapse and lesser and better outcome. So controlling the asthma with the inhaled and nebulized your salbutamol, and the prevention by the inhaled or nebulized corticosteroids and montelukast is essential to have less renal disease burden, less nephrotic relapse, prevent relapse, and finally better outcome. Also, pneumonia is very common, is because nephrotic syndrome is an immunocompromised state. So, the control of pneumonia and then early treatment of pneumonia and control of asthma is essential. Other renal diseases like acute post-streptococcal glomerulonephritis has synpharyngitic association, post-pharyngitic association, 1 to 2 weeks after the throat infection and 3 to 6 weeks after the skin infection, post-pharyngitic and post-pyoderma, your acute post-streptococcal glomerulonephritis. To treatment of those cases, throat infection, early control, better outcome, less incidence of the acute post-streptococcal glomerulonephritis. Other renal diseases like the synpharyngitic renal diseases also the C3GPs, IgA vasculitis, IgA nephropathy. Previously, the IgA vasculitis used to call Hanoch-Schulin purpura, even lupus nephritis, and in fact all complement mediated disorders like atypical HUS and other complement mediated disorders has the association with the throat infection, mostly viral upper respiratory tract infection. So treatment and prevention of these diseases relapse. We know that this diseases has relapse and recurrence. So thereby treatment of those the throat by standard fashion give rise to the lesser amount of the disease. And also the other common renal diseases like acute kidney injury has infection, commonly pneumonia, and one of the important cause of death is pneumonia. So diagnosing pneumonia is important to reduce the AKI mortality and morbidity. Then CKD is by far the second renal disease in children. Thereby, treatment of the infection association like pneumonia is essential, and this is essential to reduce the disease-related morbidity and mortality, because long-term dialysis patients, hemodialysis or PD, has higher amount of pneumonia, and also the transplant patient also they have higher amount of pneumonia. So treatment of those cases are essential, and also the other uncommon diseases they have the infection association. So knowing to treat and knowing to prevent those diseases is essential in handling the cases of the kidney in children. Prevention by vaccination is essential, is the current day practice globally. So in Haemophilus influenza vaccine, the pneumococcal vaccine, the influenza vaccine, and other vaccines as they are available should be given to all children with renal disease.